Welcome to another edition of the Vatech webinar series. This is June 3rd. This is our 9th broadcast where we are live on the first Wednesdays of the month. I am Jim Mayer, Education Team Manager with Vatech America, broadcasting here in St. Louis, Missouri. As always, I'm joined by my associate, Paul Satone. Welcome, Paul.
Hey, Jim. Great to be back with you for another webinar. May 20th was our last webinar. We had a great session with the team over at Implant Concierge discussing the steps for surgical guide creation. So that was a great session. If anybody wants to watch that one, we have it up in our Learning Center. This week, we'll be discussing extraoral imaging and minimal contact practices surrounding COVID-19. So later in the session, we'll be joined by Dr. Taras Habashi from Gardens Dental here in Las Vegas. And we'll discuss his experiences and practice dealing with these topics. So it's going to be a great session here.
For sure. I'm really looking forward to today's session, especially since everyone's getting back to work, back to the office. Specifically, ADA did have some guidelines, and we're going to talk about those specific guidelines and kind of expanding on that in the extraoral imaging realm. Paul, beyond today, what do we have coming up? I know we're moving this to a monthly, so our next session is actually going to be what, July 1st?
Yeah, so we're going to transition this into just once a month on Wednesday. So the next one will be on July 1st, and we're going to welcome back Dr. Dale Miles, who was with us for a few sessions a bit back, and really had a lot of interest in him. And we're bringing him back for navigating the nasal cavity and paranasal sinus. He'll be identifying pathologies in these areas, and we're really looking forward to this session. So that's on the first Wednesday, the 1st of next month.
Yeah, we had a lot of demand, if you will, for building on what he did in the past with CBCT, not just looking at anatomy, but what are we seeing as far as pathology. So look further later in the year, we're also going to bring him back, and we're going to be looking at more of pathologies in the dentition. So kind of starting in superior in the sinus and then moving down to the dentition for future sessions there. Paul, we do have an exciting announcement today for some additional series that we're going to be putting on. What are we calling that?
So we're going to call this Fast Track Friday. So we, until now we kind of been doing week to week these big bulky webinars here. So the whole idea is this has to have a smaller session, really focused in where there's a lot of interaction back and forth. You can ask questions during the webinar, just kind of a smaller roundtable sort of format. So we're going to call it Fast Track Friday series. It'll be on the 3rd of each Friday every month, just to keep it consistent. A lot of stuff in here for the staff, and then also for the doctor as well. They're going to be 1 hour quick sessions, so it's not going to be like 3-hour sessions. So 1 hour, we'll take a break, the next hour, and then a break, and then the next hour. So we'll start with image quality and patient positioning. Everything packed in there, especially for the staff on that one. And then beginner, EzDent-I, a lot of 2D focused image, manipulation and such, and 3D-I, and then the advanced 2-part 3D-I, more advanced session with the 3D software. So again, that's starting the 19th of June on the 3rd Friday.
Yeah, I think that's going to be great because we can, people can log in for just a one session. We're going to have East Coast times and West Coast times, so trying to get this enhanced for everyone. So specifically for doctor and staff, and like you said, more intimate session, more Q&A sessions. So really looking forward to that. Paul, this all came from everyone really just talking and giving us feedback on what our sales reps were getting from the field, what our attendees for this session or for our sessions have been telling us. What are the ways to communicate with us, especially now that everybody's going back into work, needing to get a hold of sales and service and everything. Let's talk a little bit about that.
So anything related to sales, or with these webinars, any feedback for these webinars, or especially any of these upcoming smaller webinars that you might have ideas for, or any feedback whatsoever, please email sales@vatechamerica.com. Any questions for our education team, any software related questions and training, please email education@vatechamerica.com. And then, as always, customer support at vatechamerica.com is a great way to contact support, especially if you're busy, you don't have time to call. Email is a great way to do it, so I highly recommend that. And then our website, of course, vatechamerica.com, and then our social channels, Facebook, Instagram, and LinkedIn with the handle Vatech America. So lots of different ways to get us your feedback here. So thank you for that.
Definitely. All right. Couple housekeeping things we always do, just the basic navigation of the GoToWebinar session. I keep seeing familiar names pop up on the screen every week or monthly now. People have attended in the past. We still need to go through this. You see the presenters at the top, our screen below that. Off to the right is your GoToWebinar control panel. If anyone's having audio issues, please click on troubleshoot your computer audio, or just go ahead and call in. And just note, everybody will be muted. The way to communicate with us the best is for the Q&A session. You can see down here at the bottom, questions for our staff. Paul and I are standing by. We also have our education team standing by to answer those questions as they come about, specifically for topics we cover today, future topics, or any questions for Dr. Hibashi at the conclusion of our session. So we are going to be, after the hour presentation, we're going to have about a 30-minute Q&A session. So if you do have any questions on topics covered, specific, what we covered, please do stick around and feel free to ask us questions there. I do want to note that we will not have any CEs for today's webinar session, unfortunately. Paul, you want to talk about kind of the outline of what we're going to be going through today?
Yeah, so today we're talking about extraoral imaging and minimal contact practices in this COVID-19 era. We'll just touch a little bit on ADA guidelines, different disinfecting protocols, some old, some new, and especially extraoral capture tips, focusing specifically on the fan, excuse me, on the PANS, Panorex, and the extraoral bite wings, CBCT Capture and EzDent-I Tools, how to get those images high quality as possible. And then we're going to take a little bit of looking at the console and exporting features in the software.
For sure. And then, Paul, we talked about, yes, Dr. Hibashi going to be joining us at the end.
Yeah, so Dr. Hibashi is going to be joining us towards the end of this session. He's based here in Las Vegas, where I am. We call him Dr. TJ. He's a graduate of the University of Pacific, 1996, LVI Fellowship in 2009. Also a mentor with Dr. Todd Engel, from the Engel Implant Institute, who we've had on here a few sessions back, which was a great session. So he's going to be discussing, excelling in the current market and giving his tips and just his feedback on the whole situation. So that'll be great to have him with us. Definitely.
Yeah, so he's going to come on towards the end of the WebEx or webinar today. So hopefully everybody can stick around for that. Let's really talk about the paper that came out from the ADA. I think it was back in April. If everyone notices on your GoToWebinar session, there are some handouts. I have 3 there. One of them is this summary guideline. And what we wanted to do is we wanted to highlight really the 3 topics that directly relate to the Vatech device and extraoral imaging. One of those being using disposable covers were applicable. So really we're talking about keeping our patients safe, keeping our staff safe in this COVID-19 era. Best practices and following the ADA guidelines. Looking at some things we may not have thought about. The next thing is wiping down surfaces the patients touch. What are we using that's effective but non-corrosive? We're going to talk about that. And then the third thing that ADA on those guidelines was taking extraoral radiographs whenever possible. So we still need a good image quality and things, but when can we take those? And we're going to look at the images we can take, and then get into the software to enhance those or magnify and use some of the EzDent-I features for the software there. Paul, do you want to talk something about the barriers? I think that's the first place to start for what we're used to doing when we're imaging.
Yeah, so we're all familiar with with the barriers, right? Our disposable bite stick covers, the typical blue barrier tape. So I think we just wanted to highlight some of the especially recommended now, these areas to cover on the machine, on the Vatech machine here. So these are the areas we come into physically, with the patient, to protect them and ourselves. So we may want to think about some of these things. Obviously the bite stick, we're probably all using covers for the bite stick there. We have our temple rests as well. Some offices may or may not cover those, but the blue tape is a good one for that. And then of course also the chin rest. I see now almost all the time them covering the chin rest with that blue tape, the platform of that. And also of course the hand rails, the hand grip. putting the tape on both sides of those. So that's just something to kind of consider, with a direct contact and kind of no contact approach.
For sure, it's one extra step we can take. We're all using, some offices are using this blue barrier tape on the light handles or syringes. So just extra things to think about for covering those barriers. We do know we can't cover everything on the device. We have patients that breathe on the device. We're touching the device as staff members. So the next thing that ADA talked about was wiping down surfaces patients touch. What do we use really? We've got different options. Let's start with what we don't want to use. Cavity wipes, everybody has cavity wipes in the office, but these tend to be corrosive. We really don't want to use these. They do tend to damage the surface of the hard plastic on the Vatech device. Also, alcohol wipes. You can see over here on the right some temple supports, and these are taken from some of the offices that we visited, where it really dries out or cracks the hard plastic, and you can see that flaking effect over time that this causes, and it doesn't really take that long to break this down. So what we've searched for and what we've wanted to find is something that works with directly, is effective. So hydrogen peroxide disinfectant cleaners, specifically the wipes. We want them to be effective, and we're going to get more into protecting us from the virus and use for that. Has the 1 minute contact time. So using these wipes, we're going to wipe it down. We don't want to use the spray because then we're spraying the direct spray on the device. It tends to go into the cracks of the machine. So wipe that down. It's easy to use, low toxicity, meaning non-hazardous to us as clinicians, but also our patients. So staff members, we want to keep safe there. And then lower right-hand corner here, compatible. We want to make sure that this is compatible with a wide range of materials. We did find that it does work well with the hard plastic of the Vatech device. And then also sustainable to the environment. We do want to make sure that we're using products that are sustainable to the environment there. So getting down to specifically what works well and the EPA's recommendations. So based on the EPA's emerging viral pathogen guidance, the products listed below, which are Optum 1 and the Clorox Healthcare hydrogen peroxide cleaning and disinfectant wipes, they do demonstrate effectiveness against viruses similar to the SARS-CoV-2 or the coronavirus that causes COVID-19, specifically on hard and non-porous surfaces. So therefore, these products can be used against the SARS-CoV-2 when used in accordance with the directions followed on the product on the hard surfaces there. So this whole session is going to be recorded, so you will have access to the links at the bottom of this if we need to look at more information, or you can go to the CloroxPro.com website or the SciCan.com website to look at those two topics there. So the third topic that was on the ADA guidelines, or let's jump back here, is using this hydrogen peroxide, hard surface compatibility. We've talked about killing the virus, but also we want to make sure it is keeping the plastic and not harming the device itself. So the third thing on the ADA guideline list, Paul, was extraoral radiographs, right? Extraoral radiographs whenever possible. And I'm going to let you take it from here and kind of discuss a little bit about that.
Yeah, so as far as the extraoral radiographs, in keeping with social patient distancing and protection guidelines, we still want a good image, and we want to get the patient, in and out as quick as possible, letting them know that we're taking this seriously and in keeping with all the current protocols. So I think that's really important. And then, the main concerns that offices may have when taking more extraoral than intraoral is image quality. So, the question is, will the extraoral image provide, the clinically diagnostic information that we need? So, we can talk about positioning with a different mindset, using the different, speeds and low exposure time settings on our machines, including scan time, especially. And lastly, going through some of the software, kind of gathering the best image quality out of the features of the software. So those three, those things combined can help our cause, so to speak.
Definitely, yeah. So one of the things we talked about is minimal scan time. So minimal, I guess, interaction or being too close to the patient. So one of the ways we can minimize that is by having a faster scan time. It's a better experience for the patient of getting in and out of the machine, but yet it gives us a good quality image. So specifically on the green CT2, we can take a pano with 7 seconds. So what this does, a couple things that helps. It helps minimize motion artifact, or helps when the patient might have a chance to move, it helps eliminate that. Also increases our workflow time. We can get the patient in and out, but yet get good diagnostic images here. The next thing let's talk about is how to get to that. Where is that at? So we've gone through EzDent-I, we're back at the device, and we can click on the Vatech Capture screen. We have our green option here, which is going to be our 7-second scan time. So that's going to allow us to set this up, position the patient, 7-second scan, they're in and out. The next thing, we want to go through this, but we also want to make sure we have proper patient positioning while we're doing this. How do we do this at a distance or minimal contact? Another thing we've attached on your handouts are 2 separate PDF files for you to download, which are specific panoramic positioning guides. These are also found on our website in the Customer Learning Center. So first thing we do is we know with any extraoral imaging, we're going to remove any metal objects, necklaces, glasses, earrings, objects like that. And what I have my offices do is first, let's initialize the system, get it set up, and then have it to the right proper height. So have the patient stand behind the machine. You can use the hand switch to raise the machine up to where they can put their chin just on that chin rest. Have them bite on the bite stick. The next thing we can do, we want to do, as always, have them adjust the mid-sagittal beam. And we're adjusting that. We're going right through between the eyes and right here through the philtrum. So that's going to be our line there. Some offices actually use a mirror in front of the patient where they can look, and then the patient can move their head to get them lined up. So that's one way to help. And next, what we want to do is our Frankfurt horizontal beam, and we're running that from the top of the tragus, so the top of the tragus here, to the infraorbital notch of the eye. So that should run a straight line across there. If that line is too low or too high, we can use our hand switch to raise the machine up or down, which is in turn is going to tip the patient's occlusion down. And really the proper alignment, what we're looking for is about a 10-degree occlusal angle or 10 degrees tip down. That's going to give us our pan with that nice smile. And then lastly, I usually close the temple supports, followed by adjusting my canine light, lining it up right to the center of the canine to get that optimal image through there for our patient positioning. So I think a lot of these things we can do, especially vertical position, mid-sagittal beam, even Frankfurt horizontal beam, we can do this at a distance from the patient, and then we just need to adjust our canine light getting closer to them. So here's an example of a Vatech bite wing. We've got several of these throughout the presentation. This is one an office gave us a permission to use. We're going to talk more about this, and Paul's going to go into some more enhancements of the software and how to focus in on some areas here. So I would call that a properly positioned bite wing. We also have our panorama image here. So proper positioning is going to give us clinically a diagnostic image. If you look here in the anteriors, you can see all the way through the PDL. You can see let's go through here. We can see all the way up to our root tips here, clean pulp canals here. We can see the PDL around the lowers here. I have a nice smile. I can see my sinus floor. Condyles are straight up and down. So this is really the image where we're looking for when we're imaging here. We've also added a couple images here that I would question the image IQ on. And really, Paul, you and I talked about this earlier, and this to me looks like a good image, right? I would say this is a decent image, but what could we have done better on here? What are you noticing, Paul, on here that might need to be improved?
Well, a couple things, but mainly the shadowing in the upper roots of those teeth, which would be caused by the position of the tongue. So it's kind of, it's in the way they're creating that shadowing.
Right, so basically the air behind the front teeth is causing this dark shadow. So I know one of there's always questions on this when we do our positioning at office with staff of what to do with the tongue. So once we have the patient positioned, I'm going to have them close their lips around the bite stick, swallow. What does that do? It positions the tongue flat to the roof of the mouth. That's going to allow filling in that air gap there. Paul, how are you talking about this? I mean, a lot of times we talk with dental staff and everyone is very dental terms, but when we have our patients, we need to break it down into what they can understand, or almost like a layman's term of positioning. So what are some of the tips and tricks or ways that you are talking to patients about that?
About the tongue specifically, always kind of focusing on having the entire surface of the tongue to the roof of the mouth. So I think a lot of times when they tell the patient tongue to the roof of the mouth, a lot of them will just put the tip up there. So I usually recommend kind of picturing like it's almost like there's peanut butter stuck to the the tongue, your tongue, and it's stuck to the roof of your mouth. You want the surface of it as high up as possible. So that's kind of what I use in my trainings.
Right. Yeah. Ensuring that the tongue is flat to the hard palate there. It is key to eliminate that dark shadow on there. Okay. So another image that actually we took directly from the Vatech troubleshooting guide. And if you don't have that troubleshooting guide, log on to Vatech America, go to the Customer Learning Center. There's a panoramic troubleshooting and image quality guide on here. And what it does is it goes through the exact steps of what happens if we get an image like this. And Paul, what are you seeing here? What do you think of this image? How would we troubleshoot this, if you will?
There's a couple things with this image, but I think the main focus on this one is the angle of the chin. So the chin is angled too high. We don't have that nice slight smile in the occlusion. We have actually almost like a frown there, which is caused by the chin being too high. And then, of course, it's going to affect the condyles. Sometimes the condyles are cut off completely. So I think that's the main issue here. Right.
Sure. We can also see, the root tips. We're not seeing the root tips. So with the head being tipped up too high, that hard palate is impeding on that too. So we can by tipping the head down, we're bringing the root tips down and the hard palate up, so we can see that a better image through there on that.
Yeah, and we'll dive more into that into these separate Fast Track Friday sessions. We're going to really dig deep into all the things and all the little nuances of this as just an example.
For sure, definitely. All right, I do have some questions coming in on positioning and troubleshooting images. We are going to answer those at the end of the session. So I've got some of like blurry anteriors, a couple other things. So we are going to talk about those. Stick around to the end of the session there. And moving forward, we've looked at our three ADA guidelines of covers, wiping the device down, and extraoral imaging. Paul, right now you're going to go through more of the EzDent-I software as far as some of the tools. How can we enhance these images or do consult, use the viewer, some things like that. So looks like you're switched over to your screen there, and I'm going to basically let you take it from here.
Okay, great, thanks. So I have my EzDent-I open. You can see here we have I can organize this by date or modality. You can see I have some bite wing images here and some panels. So I'm gonna open up one of these bite wing images. I'm just gonna double click on it, and it's gonna automatically take me into the viewer tab here, where we can kind of edit and go from here. So just some of the tools I just want to talk about in here. So mainly the toolbar is up here. I call it the default toolbar. We have our panning tool. We have a zoom tool. If I want to, one nice tool is I can click on this and zoom in a certain area. So if I want to take a look at that that impacted third area, I can just kind of click and drag and zoom that in like that. I'm just doing a left click and a drag right. And if when I'm zoomed in so much, and if you want to pan around the image, I can go to my panning tool, the hand, and then my cursor turns into a hand. I can then grab that and look at other areas. I can look at the other side, for example, and then I may want to focus in on that third molar. So what I can do is there's this nice tool up here. By default, it's on here. It's called the magnifier. So I can click on the magnifier, and I have mine actually really zoomed in. Let me go down to the default, which is about 130. So we can see the magnifier just enhances that little square there. I can really see the PDL nicely, the pulp canals, those types of things with this. You can also change the magnification here. If I want to go up or down, there's also an enhancement tool within that. that brings up that contrast a ton. So that's the magnifier. To exit, I just X out of it there. And then if I want to bring it back, I can just double click it to expand it. That actually full screens it. But if I want to bring it back to fit the window, you just go back and hit reset here, reset view. Excuse me, and that brings it back to the screen view. Couple other things here. On the left side, we have our windowing section. So the brightness and contrast, there's two ways to do that. I can just simply go on my image and left click and drag. I'm sorry, right click, not left click. Right click and drag for brightness, and right click and up and down for contrast. Or I can grab my slider bars over here and move those. Also, I have sharpen, the sharpen box there, and I have max sharpen. Sometimes I start at max sharpen. If it's too sharp, I'll go back to sharpen. But those are really two helpful tools there. There's also inverse, which I think is a good one for when you're showing patients different areas on the image. And then also film effect. So just different ways to look at your image. And then to reset that, I can just hit reset here, and we're good there. Also, things I can do, other tools. So under this, right now it says view, but if I click this drop down here, you know, there's measurement tools there. We have annotation tools. So if I want to write some text on my image, I can. I'm going to go ahead and use one of these object tools. So I'll go to the circle. So if I click that circle, let's say I'm showing the patient this image and I want to highlight that area. I can highlight that impacted third. So I'll just come here and make a circle around that tooth there. And I'll do the same thing on the other side here. And that stays on my image. Now, if I want to take that image and make a separate image, a JPEG image, and maybe email that or put it on a report later on, what I can do here is I can come to my capture options down here, and the cameras pop up. So there's a few different cameras here. This one right here works like a region capture, kind of like a clip it tool. And then these ones here will give you your full screen. So this right here will take the entire image here and capture that as now a separate image. It's going to say storing on the server, and then it will show up, excuse me, right here under capture. Okay, so I'll go back into my viewer tab there. And then I just want to talk about a few different defaults and the layouts here. So we're in the viewer tab again. I have mine defaulted to different frames or different layouts. So I have a frame 1-to-1, which is just pretty much one image. And here I have mine set to 2 frames. You know, but if you want to change that, you can. So like, for instance, this frame here, you can have 2 images. So if I want to pull, you know, an intro pan and, you know, a before and after pan, I can just go down to my images on the bottom and pull side by side or up and down, either one. To change the layout, I can just simply click change layout here on the left, and then all my different layouts will pop up. So I have mine defaulted to the 1 image, and that's why you see that yellow toolbar. If you want to change and make your default anything else, all you have to do is right click and set as default. There's also add to favorites options, which just means that when I go back to here, these are essentially my favorites. So you can put up to 3 of them. So just kind of a quick layout access there. So that's what the add to favorites does there.
So Paul, a lot of our offices are using this for basically a good patient presentation. You're showing your before and after image or 2 comparison images on there, right? That's how we're kind of utilizing that layout with the multiple windows. And there's a whole series in there that people can look at, and we'll look at that later on, maybe for manipulating those. Yeah. So from here, I mean, maybe I want to go into the console tab, because then I want to highlight, you know, the images in there as well. And then we also have console videos to go along with this. So if I go into the console tab, again, I have mine defaulted to 1 frame, as I call it. And I'm going to go to change layout within this tab. And let's say I want to pull 2 images side by side and maybe show an animated video, which we have in here. So I'm going to go to this one down here and see we have three frames. And I could mix and match and pull, you know, I have the Ceph here if I want to put that there. But I want to highlight that image that I took before, this one over here. Let me pull that over, sorry, with the animated video here. So on the side here, on the left-hand side of the screen, we can see we have the categories. These are all our videos are housed, so there's different specialties in here. I have mine set up already on favorites, which will show up down here.
and all I have to do is pull it to my window, and now it's going to play the animated video. There is no sound on these videos, but if you have EzDent-I, you have access to all of these.
Right. Do have a question coming in about that. Can those be exported?
So that's actually, a lot of people ask that question, and you cannot export them because they're proprietary videos. But what you can do in here is you can customize it, put your own videos in here. So you can either get those from a different source. You can make your own. So if you want to just make your own videos with your, say, even your cell phone, if you want, you can actually enter them and get into putting them into categories from within the editor of this video module here, I guess you would call it. And that's what we'll get more into that when we talk about the Fast Track Friday. We'll get into more how to customize the videos and categories and things also. But that is a common question, Jim. And then the other thing here I just want to talk about is how do I make a quick report? So let's say I'm going to go back to my viewer and I'm going to switch back on my one-to-one frame. Let's say I want to pull this on a report because I want to send it out, email it, or print it, or any of that. The easiest way to do, I could go to my report tab and pull my images onto that, but the quickest way is just to stay on the viewer tab and select this icon on the end here, send to report. If it doesn't show up, you're going to have to go to capture here, pull up capture, and then I just click this, and then boom, it's on my report, and you're ready to go. You can see it's in the landscape format right now. If I want to switch that, or it might, yours might default to portrait, I can go up to this printer icon here, and then I can switch portrait or landscape from there. So the landscape will be better for this one. And we can see that it has all my office information right on it. We have ours set up here with a sample Vatech one. We have a logo on ours. And if you need to adjust any of that in your office, all you have to do is go to main menu, go to settings here. And within the settings, there's a tab for practice information. You can just put your practice address, all that stuff right in there. You can also put a logo in there. So just have it on your drive. Click open and find your logo. You can enter it right in there. So that is how you do that.
For sure.
Yeah, and that's, yeah, go ahead, Jim.
What about exporting or just going to reports and exporting the reports out? Now, there's 3 different ways we talked about. You can do your email, what else? You can do your JPEG. Yeah. Let's touch on that because I think that's kind of completing the cycle of what we're wanting to talk about here. Right.
So if I want, let's say I want to export this image, so I can either right-click and export it here as a JPEG, but there's not going to be any name on it, so that's the only thing with doing it that way. But if you want to pull it onto that report, like we did earlier, like this one, that's kind of the preferred way to do it. So from there, I can just go click the drop down here under export. I can email it, send an email, or if I hit export, that'll save it on my desktop as a PDF. So it automatically, let me do that. Let me throw it on my desktop really quick. And that'll save it for me as a PDF. And it's all, you pull it up here. And
that's where we all wish we were at, in the Bahamas somewhere.
Right. So we can see here that this PDF, it's all good, ready to go. You can just attach it to your email from there. And then the other thing is just to print it. So that's kind of the 3 ways to export. And then the email, you have to set that up in your settings. So if you do want to email directly from here, it's really quick if you set it up. It'll just, boom, pop up your email, type your message, and good to go. But to set that up, you have to go under your main menu, go to settings, actually where we just were, and then the tab right next to the practice information tab, linkage/email, it's down here on the bottom. So it's actually really easy to set up. If you're using like Gmail or something, just Google. You can Google like what port to use and that kind of thing. It's simple. You just need the SMTP server address in there. But if you're using like a hosted website through an IT company, you might have to get them involved to set that. But that's where you set the info for that email functionality. So that is just kind of touching on some of the tools in here to utilize some of these features.
Right. Paul, I did have one question coming up. I have a user who also has our intraoral x-rays and wanted to know about ways to export the, let's say, 4 bite wings or 18 FMX directly in the report without having to do a drop and drag, if you will. So could you go like the viewer and setting up some of your options to make that 18 FMX and kind of go through a presentation there?
Yeah, so I think I do have some images. I have some intraoral images right here. Okay, so perfect. So if I go to my viewer tab, so I can double click on any of these images and the single image will pop up in the viewer. But if I just go right to the viewer tab and switch my layout here, so if I go to change layout, and you can see under the settings here, there's a tab for intraoral sensor layouts. And actually just, I made that a favorite, so that's already set. So now if I go to my layout on the left and click it, boom, it just automatically has it set for you in there. Everything's good to go. You could move those around if you needed to, but to now quickly populate it to a report, again, we can just click on this handy dandy icon here, send a report, and then it will populate those images just like that, and you're good to go. So really quick way to do it there.
Right. Can you go back to viewer there? So that's a good way for workflow of if we want to show one image, go over to the 1x1 frame off the lower left, and we can just drag images up there if we want to.
Yeah. So I want to show my pan.
Right.
You know, there I may want to show my before and after pan. And then my third favorite on the bottom, I have that FMX down there.
And that's all going to be in your change layout to customize it to what the office wants right there. So that's good. Right. And if you double click on one of those images, it should enlarge just that single image right there. But there's so many different frames through there. Again, this is something we're going to be covering in our Fast Track Fridays. And also on our Vatech website, you have more information specifically on going through these tools through there on that.
Yep.
Well, I think, we covered pretty much everything we wanted to cover in the, specifically with the EzDent-I software. One last thing we could do is, well, if you switch it back, that's all right. There is a way to go ahead and switch over to do an export of the image, but we'll talk about that on our Fast Track Fridays there. Let me do this. Let's move on to the next topic, which is going to be, we've covered our 2-dimensional imaging. And now I would like to talk a little bit more about 3D positioning. I always talk about this being, excuse me, a 3-step process. This image here might look familiar. We used this several weeks ago when we had Dr. Engel on. We used this for an implant case. If you're interested in that, he placed 5 or 6 implants, went through some guided surgery, how he talks about talking to the patient. So that's something to refer to back if you're interested in that. But let's talk about specifically positioning. How do we keep that social distance or keep our patients and ourselves safe? Again, we're going to go with the green CT2. We have a 4.9 second scan. Minimal time, reduces motion artifact, safe for our patients, get them in and out. Also lower dose radiation with that minimal scan time there. If I go over to my CBCT Capture interface, how do we get there? From EzDent-I, go to our 8x9 scan is what we're going to be highlighting here. That's going to be a 4.9 second scan. If you're using one of your larger, say the 18x10 or 16x9 scan, that's going to be a 9-second scan there. But you can see we're down to a 4.9 second scan here, specifically for our patient there on that. All right, let's go over here. Moving from there, CBCT positioning. Another thing you have attached to your handout over there, you have a PDF guide of this specific positioning. I talk about this as a 3-step process. Take off any metal objects, just like a pan. Have the patient come into the room. We already have the device initialized. We're going to align have the patient stand up straight and tall, and using my hand switch there, we're going to go over and, whoops, pardon me, I hit the wrong button there. We're going to go over and we are going to use our hand switch and get the proper vertical height. So I want to bring the chin rest just below the patient's chin or right to the patient's chin there. Have them come in the device, either bite on the bite stick or use the edentulous cup. Again, we're using the mid-sagittal light where we can have them line up center between the eyes and right through the philtrum. We do have an axial light on the G2. It does not move. It is a fixed beam, specifically projects on the targeted anatomy. How a lot of us talk about it is I use that beam to ensure that the patient's occlusion is flat or parallel with the floor. So we do want a flat occlusion when we are positioning our CBCT. We do not want the head tipped down the way the pan is there. So after we've captured our image, what happens if the patient moves? We've looked at this scan in past features, but we have a result of patient movement. You can see our axial slicer. We do have some shadowing or blurring on the mandible there in our axial slice with the red arrow. But also look over to the right where we have our virtual rendering. It's basically blurry in the anteriors. You really cannot see the crestal ridge. If I have the patient still in the device, not moving, we get a clean image, no blurriness, no double image or micro movement. We also have a nice crestal ridge right there where we can see the crest of the ridge, occlusal surface of the image itself. All this, I think, can be done from a distance to get a proper image. And then after this, we're going to talk a little bit about exporting the image. We've taken it, we're happy with it. We may be sending this to the radiologist, to another office to get guides made for surgery. But let's go through how to export. While this is loading here, we do have this specifically on our Vatech website, these specific guides and a video to do that. So we're going to go up to main menu. I'm going to go down to export over here. And what that's going to do is going to give us a pop-up window. And that pop-up window is going to have options at the top, CD or DVD, local disk. So local disk we're going to do in this instance. We can compress that file, lossless there, or we can just click on the check mark, it will compress it there. And then we have the CT also off to the right, a project file and viewer. So if I want to add the viewer or the project file, we can do that. What this is going to do is take us to where do we want to save this at? We're on our desktop, we've set up a file, click select folder. Now it's going through the export process. Some questions we get, how long does this take? I always say it depends on the size of the scan and the speed of the office internet, if you will, or the networking. Generally 15 seconds to 20 to 30 seconds maybe to export that and save that to the desktop. So next, let's figure out where we put that. We have our export scan folder. Double click on our file here. You can see we have our submenu CT. That's going to be the raw DICOM. So if you are sending it to a lab or if you want to send it to a third party software, you can directly use it there. And then also your Simple Viewer Launcher down here. Double click on Simple Viewer Launcher. If you have added the viewer, this is going to allow us to open up either the Vatech 3DI software that we have or what we call our Simple Viewer Lite. So to open the Vatech 3DI software, there are some computer and graphic cards requirements. It's listed right on there. And then off to the right, your Simple Viewer Lite, you do not need a dedicated graphics card. It's less system resources. You can still work with the software and utilize that software there. So I think that's a topic that we get a lot of questions on for there, but those are different ways to do that. Lastly, let's do some Q&A. Let's see what we have coming up. And some of these, we've actually have 3 topics here, but I want to go look over our questions here. One of the things we have on here is utilizing a mirror, allow the patients to see themselves. If when they're in the device, they can look at themselves in the mirror, we can tell them, hey, we need to get you lined up with that mid-sagittal beam. They can physically move left or right to get that beam lined up. Other things we can do, we've talked about first moving the device to the proper patient height even before getting the patient in there. So if they stand up straight and tall, we can kind of eyeball to see if that chin rest is in the area of what we want to capture. Then lastly, using the up-down to adjust the head position. We can do it on the touchpad right in front of us, or we can use the hand switch. Use the hand switch, you can kind of step back away from the patient, move that up or down to capture what we want to see on there. So those are some ways to do that minimal contact patient positioning there on that. All right. Well, I think it's time to bring up Dr. Hibashi.
Great. Let's see, Dr. Hibashi's here. So Dr. Hibashi's a practitioner here in Las Vegas. We call him Dr. TJ, but he's got extensive training in TMJ and TMG treatment, cosmetic and implant dentistry, as well as facial aesthetics with fillers and Botox. In 2009, he completed a fellowship in full mouth rehabilitation and neuromuscular dentistry at the world famous LVI here in Las Vegas. He also mentors and co-lectures for Straumann and Neodent implants and at the Dr. Engel Institute since 2016. So welcome, Dr. Hibashi.
Hi guys, how you doing? Thank you so much, Jim, Paul, for that great informative webinar. Every time I listen to you guys, I learn more. I myself got the Vatech CT machine last year, and not an expert on it yet, but anytime I have any questions, I call Paul, and he's just within a phone call away. Anyways, I know I look a little different than the picture that these guys posted. This is my post COVID-19 look. No haircut for 3 months, and I decided to grow a little hair here to kind of fit in with everybody else. Good afternoon, everybody, and good evening to the people back east. I hope you guys are all safe. You're doing well during this challenging times. I'm no expert by any means. I'm a general dentist, like probably most of you. I just like to go over some of the stuff that I do in my office. It's kind of kept us safe and successful. I also have been practicing dentistry, and I've been in private practice since 1996. I have gone through the 2008 recession and dealt with those challenges, and kind of went down and up and survived it, and actually did pretty well, you know, coming back. So that said, you know, these are really challenging and demanding time for us guys, and we're one of those practices that always gets affected by anything that happens out there, because we are, you know, I always thought dentistry is a very challenging career anyways, because we are neither essential or non-essential. We don't fall into either one of those two 100%. You know, people want to get their cleanings, and if they have a toothache, we suddenly become essential. But as soon as you talk about, you know, elective treatment, or hey, somebody who's just a cosmetic dentist, or who does, let's just say, implants, they're non-essential because hey, they can survive without it. So, and you know, so we always fall into that. And what are we? Are we a business? Are we, you know, a medical office? And that's always been something that I've kind of thought very challenging myself, and you know, trying to deal with it. And doing this for 20-something, 23, 24 years now, you know, I've learned more and more about it, and I've tried to improve myself, and have tried to, you know, see how I can better myself to kind of overcome these challenges. So, and now of course they throw us this whole, not, you know, not that somebody did it, or maybe they did, and now we got this COVID-19 thing to deal with. So I will go over some of the things that I do here in my office. I have a pretty small 5-operatory office. I have 2 hygienists. I have about 7, you know, employees. I work about 4.5 days a week, and so I think that's probably pretty much what most 90-80% of dentists out there have, unless you work with a group practice. So I will go over some of the stuff that we do that, you know, that I think it's required by CDC and ADA now, and hopefully that can help you guys out a little bit. And I am going to actually look at my list. I don't want to forget anything as I do this. So some of the things that we do is, first of all, is I like to keep, of course, my staff or my team safe all the time. They're my priority. They're like a family. I deal with them first. Then that automatically basically reflects on the patients, and we take care of the patients when needed, or, you know, as needed. So the staff, what I've done with them is I communicate with them all the time. I have a lot of meetings. I have huddles, and that's what I recommend you guys should do. I have retrained them, and we keep talking about, you know, proper PPEs and how to wear them, and how to take a mask on and off, gloves on and off, even though we assume they already know how to do that. Some really don't, and they still need to be trained on that. I mean, you might have to train yourself on how to do those properly. So I think that's really important. Another thing that we do is every morning we check the symptoms of the whole staff, temperatures and symptoms, and we log that, including myself. Just want to let you know that I personally got tested for COVID a few days ago, and I got tested for the antibody a couple weeks ago, and they're both negative. And I just did it because I really wanted to see what it felt like, and I wanted to see what it was involved. You know, most people said it hurts and it's uncomfortable. I wanted to see how it was, and I encourage them to do it. To do it for sure. I think if our whole team and yourself are getting tested regularly, and the patients know, that would kind of improve our their confidence in us. You know, that hey, I'm going to an office who is regularly getting tested and is safe. So the other changes that we have made in our office is basically our waiting room. We used to have about, I think, 7 chairs in there. We're down to 3 now, so we took most of it out. All the chairs are out. We have 3 chairs only. They're about 8-9 feet apart. All the magazines and books are removed. There are hand sanitizers in the waiting room, in the check-in area. We try to keep as much of the things as touchless as possible, payments and so forth. But if, you know, there's a few things that people need to sign. So we have a couple of cups or pen holders out on each side, the check-in and the check-out. We have used. We basically label them used and clean pens, so people know which ones to grab, and we clean those up. We actually have schedules. We have hourly log disinfectant procedures that we wipe everything, counters and so forth, and we have actually posted that so patients know that we do that. We have basically sent emails and text to patients telling them what we expect people to do before they come in. We recommend they have masks on. We talk about the signs and symptoms of COVID-19, the regular things like shortness of breath and, you know, the fever and the sore throat and so forth. And we remind them that when they come in, we are going to take their temperatures, and that's the first thing that we do. And we talk about their symptoms. Then as patients do walk in, we escort them to the bathroom. We have them go wash their hands and rinse with hydrogen peroxide for 30 seconds. I think that's one of the recommendations of CDC, and not CDC, ADA for us. Let's see, we recommend that patients only come by themselves if possible. If they do need to come with a ride, like minors or some disabled people, we ask them to either wait in the car. In Vegas, that's a little tough right now. It's about 110. So, you know, thank God gas is cheap so they can turn the AC on. Let's see, for employees, I have all my employees, my teammates, I have them all leave their scrubs and shoes here and basically change at work. And if they want to take their stuff, they take it in a plastic bag. We don't want people to see them come in like that, and also it's just for their own safety and their family safety. I've changed my schedule a bit. I have 2 hygienists, so what they were doing was from 8 to 5, so we kind of changed that schedule. We staggered it. We try to do that from, instead of doing 8 o'clock patient, we're doing 8 o'clock, 8:30, 9, 9:30, so we staggered in their patients, eliminate some of that traffic. I did the same thing with my own schedule. I kind of staggered it. I went from 2.5, 3 columns to 2 columns, and I'll kind of go over how I make that work. I know that's the difficult thing because everybody's thinking, well, I'm busy. I got to do 3 columns. I got to do 4 columns, and I get that. I've been there. In terms of masks and PPEs, I know we're not all able to get everything that we need, and I get that. I have that challenge also. I don't have that many N95 masks. I only got a few. So what I do is I actually, I have a level 3 mask. And I'll be honest with you, I didn't know much about masks until this COVID-19 thing happened, and then learned so much about masks and levels and this and that. I was like, just give me a mask, whatever they give me, I put on. So now what I do is I put on a level 3, and I double mask with the level 1, especially for surgeries. And so that way, because I can get a lot of level 1 and level 2 masks, but level 3 mask and N95 masks are really hard to come. So that way I can keep it N95, I can spray it, I can, you know, disinfect it if I want to, and I toss all my level 1, level 2 masks. So that helps out. I do have loops that I wear. So I have a face shield, which I bought from Orthoscopic, which actually fits my face shield and my light. Let's see, what else? We do a lot more. Basically patients, before we work on them in the operatory, we grab their phone, all their personal stuff, because most people like to throw that stuff on the counter. So what we do is we bring a Ziploc bag, and actually we take all their stuff and put it in a Ziploc bag and give it to them at the end. So that eliminates any kind of that aerosol COVID-19 stuff. In terms of procedures in the operatory, while you are working in the operatory and basically working on patients, I've adapted by getting a few things, buying a few things, which actually worked really well. And I've actually retrained my assistants a bit as I'm working with them. So a few things that I do use to eliminate or decrease the amount of aerosol that's affecting us is I've got a high volume evacuation machine, which I use, which your supplier can actually talk to you about it. I do use a suction to retract when possible on patients myself instead of a mirror. I actually have I just bought one of these things, which is kind of cool. I don't know if you've seen these before. That's a little mirror, which is actually a suction tip too. I use that. That eliminates some. I've actually instructed my employees not to blow air and water on preps anymore, or on, bloody or even in mouth anymore, to eliminate as much as that's possible. I try to use a rubber dam when possible. I use a dry shield when possible, and I keep the same when possible, because as dentists, we all know not everything is possible all the time. We know that there's different difficult situations that we always have to adapt to. So those are some of the things that I do to decrease some of the patients' exposure to aerosol and ourselves and the team. The last thing I want to talk to you about real short is about surviving this post or current COVID-19 crisis that we're dealing with, and how the heck do we survive? Does our business survive in this? I think a lot of that has to do with you. A lot of that has to do with what you do and what you can do. Same thing happened in 2008, 2009, and especially in Las Vegas, as you guys know, we got hit really, really bad. About 30 to 35% of the dental offices closed down. They just wrapped up and left town. But we survived. I survived. I did well, and we came back. It's going to happen. We all know this is not going to be our last crisis. It's not our first. It won't be our last. So here's my recommendation. As somebody who's had 23 years of experience, and I'm doing pretty well, I've been pretty successful, is better yourself. That's all I can tell you, is better yourself. What I mean with that, in dentistry, you've chosen a career, which is amazing. I think I love dentistry, just love it. I know so many dentists that don't love it. If you don't love it, start loving it, because I think it's too late to have a different career. Start loving it, start liking it, or find out why you don't love it and try to learn to like it. So what I recommend is, look, go out and see what it is that you don't like about dentistry and try to improve your skills. Because I tell my kids all the time, I said, Dad, I don't like playing tennis, or I don't like playing chess or something. I always tell them, you only don't like it because you don't know how to do it. If you're good at it, you will like it. And I think the same thing is true with dentistry. I think if you learn how to do a root canal the right way, or fast and efficient, you will like it. I think if you learn how to do surgery, you will like it. There's so many things that we can offer in dentistry, where we're taught how to drill and fill. We're taught how to do carriage control only, and refer everything else out. I'm sorry to say, I have a lot of friends who are specialists out there, but guys, as general dentists, we can keep so much of this stuff and do it ourselves. We have to do it as good as the specialists do it, but learn how to do it. Just a few things here, and I'll finish up. Just look at all the procedures that we can offer, or we can do as dentists. We can, I made a list, and I was like, as I was writing it, I'm like, whoa, You know, we can do the regular carriage control and perio and all that, but you know, we can do veneers, we can do full mouth rehabs, TMJ treatments, sports guard, mouth guard, snore appliances, sleep apnea treatment, implants, overdentures, hybrids, all on 4 procedures, wisdom tooth extractions, surgical extractions, bone grafting, GTRs, periosurgery, Invisalign, braces. You can open your own lab in your office. You can do nitrous, twilight, IV sedation. You can do fillers if your state allows it. Fillers with Juvederm. You can do Botox. You can do all this stuff, you know, but you need to learn how to do it. And this is, if you haven't done it, this is the time to do it. I do most of these, you know, and I try to learn every day myself. Not every day, but I try to improve myself by watching videos, taking classes, and I mentor and I learn from my mentors. But that's how I survived in 2008, because I know friends of mine who just did cosmetic, and as soon as the economy died, they died, you know. But I went back to my basic fillings and root canals, and I survived. I was able to pay bills, and that's what I recommend for you. So, you know, with that said, I wish you all good luck. Thank you so much, Paul and Jim, for inviting me. I want to say Paul's amazing. Every time, like I said, I have any questions on Vatech, he's just one cell phone call away. He's come in about 3 times and trained my staff and myself. And you know, another thing is, as you are investing in yourself, unfortunately, you have to invest in equipment. You have to buy toys. You just have to. It'll pay back. It does pay back. It took me a while to get into a CT or intraoral scanners, but when I did, I kind of kicked myself in the butt by not getting it before that. So now that I have, I'm really happy, and I'm more excited about doing dentistry than any other time. So that's it. Thank you guys. Thanks for having me, and good luck, everybody. Okay, stay safe.
Doctor,
Thanks, Jim.
thank
Thanks,
you
Paul.
for your time today.
Of course.
Yes, we have a little bit of information about your office here for the audience, and if anybody has any questions, this information will also be emailed out, your email, after the session, so they can contact you specifically about any of the things that you had talked about, or to connect with you through there.
Sure, yes, anytime.
Paul, do we have any questions specifically for Dr. Habashi?
I'm just looking through the list here. Here's one that will apply. So have you had any patients that have been hesitant to come to the office? How have you dealt with that?
That's for me? Question for
Yeah.
me? Okay. Yeah. You know, I've always tried to be very honest with my patients, and it's worked out really well. If somebody's hesitant, I just tell them about all the things I just told you about what we do. And I have all this listed on my website. We send out Instagrams. And look, I'm not perfect at the website and Instagram and social media. I got somebody kind of improving that stuff for me. I'm terrible at that stuff, but getting better at it. And we've listed everything. We text things to people now. And I tell my patients, hey, go on there, see what we do. You know, we're compliant with all the CDC and ADA guidelines and OSHA guidelines. And at the same time, I tell them, look, if it's nothing emergency at this point, wait, just hang on. There's no rush. And when you don't push people, I think when you don't push people on things, they will trust you more and they will come back. It might take a little longer, but they will come back, you know? So that's what I do.
Perfect.
And that's how I do my treatment.
Jim, anything you want to add in here?
I think, Dr. Habashi, thank you so much for coming in today.
You're welcome.
We do have a couple other questions specific about what we had on the presentation. Again, if you want to take off, great. We really appreciate your time. Thank you for supporting Vatech and being a family member and being part of that relationship. We really value you and all of our clients and users out there. So thank you.
Thank you very much.
Bye-bye.
Paul, do you want to kind of go into a little bit more into the software?
Yeah, I do have a couple questions though that would apply. Let's see, about Lysol wipes. So back to the sanitizing questions.
Yes.
So I know we don't recommend, Cavi wipes and things, but can we use household Lysol wipes?
And we are not recommending those. Yeah, we're really going with those 2 hydrogen peroxide wipes is what we're wanting to be using.
Okay, got it. Next question, what's the best disinfecting protocol for bite stick itself after removing the barrier? So, I mean, I guess, can we autoclave that? What are our best options there?
Right. We definitely don't want to autoclave. We know that is, we do not want to do that. We don't want to use a cold sterile. What we really want to do is wipe it down with that hydrogen peroxide wipe, either the Optum one or the hydrogen peroxide wipe of another brand there.
Right. And another question, what about Optum? I've never heard of these. 33 TB wipe?
We'd have to check on that. We'll do get some more information on that one. That one I do not know. I'm not familiar with, but we will.
Yeah, I mean, I guess as long as if it's hydrogen peroxide based, I guess that would be fine.
Yeah, we'll have to go through and put out some recommendations. But the 2 that we had on our website, those are the ones that we're recommending, is the Optum one and
Right.
the hydrogen peroxide Clorox wipes there. Yep.
Got it. And then another question about, somebody asked about blurred anterior roots and what are the causes and how to correct that. So that's a great question.
Yeah, I think that's going to be a lot of basically a malpositioning error, or the patient may not have been positioned properly.
Right.
Right here, you can see we do have anterior image in the mandible that's proper, but we have a certain focal trough that we're capturing. So if the patient's out of that focal trough, we're going to get that blurry area there. So we may not, there could be a lot of things, but usually it's they're not biting in the bite stick properly, they're too far forward, too far backwards. Could be one of those issues with that bite stick issue there.
Yep. Could be the canine light as well, out of position.
Right.
Okay. Here's another question, Jim. I think this is a good one. I keep getting a white triangle on the bottom of my pan image near the bottom, like a spiked triangle. What is?
Right, I think I know what they're talking about. Usually what that is probably going to be, and let me get this drawing tool here. So usually what we have is in the inferior border of the pan, we have that radiopaque area that comes up like a triangle. That is usually going to be caused by the lead apron being too high in the posterior on the back of the patient. Basically, we're blocking the beam, causing that issue in the anterior. Also, sometimes we'll see this little arc here, and that's going to be a patient's necklace. So we do want to make sure we have that lead apron on properly right up against the throat here and low in the back, and that's going to allow that beam to capture our anterior images through there.
Right. Let's see, what else we got here? Where can we access the webinars, and do you have other videos available? So this might be a good one if we want to show the website.
Yeah, let's go over to our website here, and I think I should have had this on screen, but let's add it right now. Let's go. I think of almost everything here, but here's our Vatech America website. You see our webinar schedule up here, which will take us to current or future webinars. But if I go under service and support right here, and then I'm gonna scroll down, I can see my customer learning center here. So this goes through software off to the right. We also have, so here's our software here, EzDent-I software. We have our EZ3D Plus, which is the past generation of our software. EzDent-I here, EZ3DI, and then here's all our webinar information right here that we have. You can find troubleshooting guides within the PacSci imaging or any of your CBCT imaging over to the right. That's going to go through troubleshooting guides with the pans and things through there. If I go over here to my webinar section, it's going to ask you to create a new account. Let's go ahead and click log on. And here are our past sessions, an overview of the EZ3DI, clinical applications of EZ3DI, all the way down to where we had Dr. Engel going through case presentation, Dr. Miles doing a 2D to 3D comparison of anatomy, then going into more CBCT anatomy, Brought on Gary Cady at Next Level, looking at improving our practices, complete health dentistry. And then also off to the right, last week was our May 20th implant concierge of a full workflow of guided surgery, of taking the image, sending it to the lab, what the lab does, looking at 3D printing, all the steps you need for either in-house 3D printing or sending it away. So it gives you the idea of steps 1 through 6, 7, whatever it is, what you can do as far as in your office through there. But yeah, that's where you can find all of our videos, is on our Vatech America website there.
Great. So any last questions, guys? Please feel free to enter them in the question box on the toolbar. Jim, do you have anything on your end?
I think, let's see, I think we are getting to actually the end of the questions. I think one thing I think I would like to highlight with you is going over what's coming up on our webinar series in the coming weeks.
Yes.
So we do have, let's go back here, we do have Dr. Dale Miles coming back in July, going to go into more of that paranasal sinus, looking at pathology through there.
Right.
We also really want to talk or highlight more of our fast track Fridays. If you have questions on the 3DI software of how do I place an implant or want to get into more topics, this is where it's going to be smaller groups, a lot more Q&A going through specifically on software of EzDent-I, EZ3DI, advanced session of EZ3DI, looking at more clinical cases. And then like Paul, you said in the beginning, more positioning for the staff. So one of the big things with feedback we got from everybody before we started this was, I want my staff involved. I want them to understand what 3D software does. How can I have them further enhance my office? This would be staff and doctors highly recommended. We're going to have times basically from morning sessions with the East Coast, 9 to probably 1 in the afternoon with the East Coast. Those are going to overlap, and really we're going to have 9 to 1 a.m. sessions with the West Coast. So both coasts are covered, everybody in the middle of the country. You can log in as necessary if you just want to do a quick 1-hour session, find out what it's all about. We're going to be reoccurring these every month, just as an added value to our clients there.
Yeah, that's going to be great. Go through that sessions. Especially any staff, we haven't been working for a while. Any of those sessions, especially in that beginning image quality and positioning session, we'll really dive deep into it. People will be able to ask questions the entire session, so it's gonna be really really more personalized. So that should be great. Any feedback, please feel free to send it our way.
Right, for sure. Customer Learning Center actually physically went to there, but we do have a slide for the past webinars or any other information you need. Everybody's getting back to the office. If we do need to get to customer support, what I really recommend is going to our website and looking at the FAQ. There's a lot of questions on how do I export CTs, what size flash drive should I use? So common questions that you probably have, but you can use or find without needing to get a hold of technical support to fast track getting you back running with your office there on that. And then lastly, we do not have any CE provided for today's session on there. And then I really want to thank everybody for joining us. Please look at the email from the Vatech education team. We're going to highlight what we've done in the past, give you links to what we're going to be doing in the future from the Dr. Miles and all the June 19th sessions there. So, but that will be, and we're going to be running this through the summer. We do have some other guest speakers that we're going to be bringing in. So we'll be announcing those also in that email. The August, actually all the way through September, I believe the schedules, we're finalizing a couple of things there. So again, from the Vatech family, I want to thank you all for joining us. Dr. Abashi, thank you for joining us. Paul, as always, it's been fun planning this and getting this scheduled. So everybody stay safe out there, and we look forward to seeing everybody in the future. Thanks again.
Thank you.